everybody, so I've been telling you guys for a while that I am going to take you along to a dental office and show you exactly how I get my hybrids cleaned, and today I'm at ASAP Dental with Dr. Ahmed, and he's going to be doing my cleaning today. Excited to be on my YouTube channel?
I'm really excited. Hey guys.
Awesome. And I want to thank ASAP Dental Care for sponsoring this video. They are an awesome company. They've got about 7-8 locations in Northeast Florida, and they offer same-day smiles 7 days a week, and so I'm really excited to be working with them. We're going to be providing more content like this in the future, so make sure that you subscribe to my channel so that you get all of these updates and get educated on what happens in the dental office.
And you know the great thing, Christy, about ASAP Dental, we're open 7 days a week, and we actually can provide all the dental services. We do everything from cleanings to crowns to all the aspects of dentistry, and we're available for you. You know, like sometimes when it's a Friday night and you feel like, I think I want to have a cleaning on a Sunday.
Right.
Where can you do that except ASAP Dental?
That's
so,
awesome.
Folks, check us out.
All right, well, I guess we're gonna go clean my teeth now.
Let's do it.
Yeah? So first thing's x-rays, right?
Yep.
And April's gonna be getting my x-rays, so let's go.
All right, see you over there.
Thank you.
All right, thank you.
Okay, so we just got done with the x-rays, and now we're here with April, and she's the hygienist, and she's gonna explain to us like why we need x-rays. What's the big deal if we look in the mirror and our teeth look fine? Why do we need them?
Absolutely. When we are looking in your mouth and we're cleaning everything, we can only see from the gum line up. And on the x-ray, that's about here. So you can see all of the structure underneath that we have no idea what's happening to unless we take x-rays on occasion so that we can see how healthy they are. Implants can't get decay, but they can get bone loss, just like regular teeth. And checking for bone loss, one of the major tools is being able to see it on an x-ray.
Right, and so are there situations, because I think that sometimes people will forego going to the dentist because they're not in pain, everything looks fine visually. What kind of things could people be experiencing and have no idea?
Sure, absolutely. Very beginning baby decay, you don't usually feel, and that's when it's easiest and cheapest to fix. So finding problems like tiny infections or tiny decay earlier is going to save you a lot of money later, as well as increasing your chances of keeping that tooth after it's restored. The things that I'm going to look for as a hygienist are the bone levels around the implant. Now I'm going to combine this with other information once I'm in your mouth to know exactly where and how to clean them, but this is half of the puzzle for me. So without this, I wouldn't have all of the information I needed.
Who knew? All right, so now we're gonna get into the cleaning.
So the first thing I do before we're going to start any type of cleaning is check tissues. If you think about going to any of your regular doctor's offices, no one's checking your mouth for oral cancer. So we're the first line of defense on looking for things that aren't normal or changes, things that stand out to us. I have a couple of tools here that are all geared towards safety around implants. Implants have a softer surface than the surface of a tooth would. And we're not talking about the actual tooth part you see, but the part that kind of goes down into the gum and the bone. So everything I have here is either made or built to protect those surfaces as I clean them. They're very different than regular hygiene instruments, even though they look exactly the same. I have a little tool that measures alongside the implants. We do this with natural teeth as well, but we use a really soft plastic one when we measure around implants. And what we do is we combine these measurements with what we can see on the x-ray to determine if there are any areas that have more bone loss than when you were here last time. We can watch for changes that way, catch changes early and treat them early to prevent future damage. So this is my favorite tool. This is the one we're going to start with. This has a really protective soft rubber tip on it, and what this does is it vibrates very quickly and sprays water. That way it can reach under the overdentures and clean around the implants in areas that I may not be able to reach as thoroughly. I'm checking for debris, signs of inflammation, anything that needs extra attention as well. One thing that this instrument is doing that I'm doing while I'm in there is knocking off any buildup. The same buildup that attaches onto natural teeth can attach onto implants. That is from your saliva. It hardens over time in hard to reach places, so it needs routine removal. That, when it builds up and sits in a spot for too long, is what causes inflammation. Inflammation causes the bone loss, and then you can have integrity problems with the implants later. So it's really important to remove that regularly. I can reach under the overdenture with this instrument, and so not only is it removing any buildup that may be on the actual implants themselves, but it's flushing out any debris that may want to sit under little hard to reach areas too long and irritate tissue. So we can see in a couple of hard to reach grooves and areas, there is some stain that's built up since the last time you were in. That's easy for us to remove. What we'll actually do today is, since we are removing everything, we'll put it in a solution that safely kind of effervesces all of that off. Once we've done that, one thing you can do to help prevent future buildup at home is something like a whitening rinse, because that's going to gently kind of effervesce stains off before they get a chance to solidify and soak into the denture. You don't want to use really harsh toothpastes or hard toothbrushes. That's going to eventually cause potential damage to the actual denture over time. If it's not going to come off with a soft brush, it's not going to come off. So make sure you stick with gentle toothpaste and soft bristle toothbrush. Once I know that I have flushed everything out, really cleaned the actual implants really well, I'm going to use floss to thread under the denture, move it around gently, make sure I am completely removing anything that I may have loosened. Not only do we want to keep the implants themselves healthy, but your gums under that denture as well, and they'll become very easily irritated by food that sits in the wrong spot too long, so this will make sure that nothing is left behind. I'm going to use a little floss threader today. It's kind of like a sewing needle with an eye in it, but there's no needle on this. It's just a soft little piece of plastic. This helps me feed the soft floss under the denture. There are a couple of different products you can use. Super Floss is a great one. It's a really thick, almost cotton ball type floss that does a great job at home of almost scrubbing under the denture as you floss at the same time.
So that's the one I use, and I showed you guys how I use that, so you recommend
Yep,
that?
absolutely,
Okay.
absolutely. So what I'm doing with this floss threader and floss is getting in between these implant sections. What I can do on these outer edges is actually loop it up under the denture directly, because there's no implant in the way. So I'm only having to feed it through where there is an implant on each side, and I can't actually get to it from the outside. Now that I've used the Cavitron tip, what I'm going to do is transition to these hand instruments. And like I said, they look very similar to regular instruments that we would use on natural teeth, but these are a material that are very safe to use against the surface of the implant. Most of the time, we're not having to scale the surface of the implant unless there's a bone loss situation, but in case we needed to, these would be safe and able to do that properly. So I am just feeling around the sides of the implant, making sure there's no debris that needs to be removed. With natural teeth, the debris hangs on and grips the surface of the tooth really tightly, and you have to put a lot of pressure to remove it. That is not the case with implants. It can't really bond or attach to the surface. It just sits there until someone comes along to knock it off, so it's much easier to remove, which is also safer for the implant because you don't risk scratching it as much if you're not having to apply a lot of pressure. The dentures themselves can scratch, so I'm careful not to use these instruments up against the acrylic. And since we are going to remove hers today, we are going to fast forward this a little bit, and once they are removed, I'll be able to go back and do the same thing. All right, so normally if we were not removing these, because we don't remove them every cleaning, we only do that on occasion, sometimes every couple of years. It's different based on the person, and that is up to the doctor as well, so I won't be making that call. And if this were an appointment where we were not removing this today, I would make sure I'm using these hand instruments very thoroughly. If there were any spots with staining that I could get, I would use a polisher without any polishing paste. Again, that's kind of like a gritty toothpaste, so I don't want to use anything abrasive against the actual dentures themselves. But since we are removing them today, we can go ahead and pause now, remove them, and finish the second half of the cleaning with them out of the way. As far as how often one should come in for cleanings, that's also up to the person. Just like with natural teeth, different people build up at different rates. Different people are at different levels of risk as far as gum disease, bone disease. So it's really up to you and a combination of your home habits and how your body reacts to the bacteria that's in your mouth.
Okay. Did you see anything of particular interest when you were cleaning? Anything that I might have missed, or?
I didn't see anything of particular interest or concern. You're doing a great job. If there were any areas you were missing, it's my job to not only bring those to your attention, but give you different techniques on how to reach those as well. I do see, again, that little bit of staining, and using kind of a whitening rinse that has some effervescent properties at home will help keep that limited between visits.
So one of the things that, I've dealt with in the past, and then a lot of my viewers deal with, is they have sensitivity issues, and they're very nervous about going in, even for the smallest thing, even for basic cleanings, and this can cause them to be more jumpy. They probably tense up. Like, what are ways that you can maybe alleviate any kind of sensitivity issues, or
Sure. Well, what you want to understand first is that that's normal.
we expect that. But communicate with us. Let your hygienist know what worries you. Let us know what areas tend to be more sensitive than others so that we can do things on our end to keep you more comfortable. We have a couple of different ways we can do that. We have topical gel that usually does a really good job of kind of taking some of that pressure off. And not that we're ever applying pressure, but if your gums are sensitive, you're going to notice things a lot more than someone who doesn't. So using some kind of topical gel will help ease that.
Right. And so I guess, you know, for me, I don't want to feel like I'm a baby. So I try to tough it out even when things are very uncomfortable. How do you feel about somebody just vocalizing like, hey, that kind of hurts?
Don't tough it out. If you think about if you go to get a massage and a masseuse says, tell me if the pressure is too hard, too firm, they're still going to get the job done, but everyone's completely different. So if I see 8 to 10 people a day and everyone has a different preference, I don't know what that is unless you tell me, so I'm relying on you to tell me.
That's really good to know. So there you go. You know, it's normal and they've got ways to treat it. If you have sensitivity issues and you feel a little uncomfortable, they can do topical gels. Then they see it all the time. They're used to this. So
Absolutely.
that's good to know.
Yeah.
So I'm here with Dr. Ahmed again, and he's going to be removing my hybrids. But we've got my x-ray up here. And what, as a doctor, what are you looking for when you see an x-ray?
Well, typically, Christy, it's a very good question. On when you've had a hybrid, there's implants under there. So you've got 4, as we see, on top and 4 on the bottom. And what we're looking for really is any signs of bone loss around the implants. Is there any signs of periodontal disease, which means that the bone is dissolving around the teeth? Is there any signs? Basically, the gums we're going to check in your mouth. We're also checking for, are the screws in place radiographically? In other words, on the x-ray, I can see all the screws inside the implants there. They look good. I see the bar there that you can see that's inside the hybrid. You've probably seen that, right, Christy? Mm-hmm. How they constructed the strength in that bar.
So now the dentist is going to be removing my hybrids, and to do that, he has got to get access to the screws. So he's drilling out the composite material, and underneath the composite material, you'll see that he's pulling out what looks like thread or cotton. This is just kind of like a gauze type of strip that provides a barrier between the composite material and the screw so that the screw isn't actually filled with the material and is accessible and not compromised in any way. Once all of the material is out and the screws are accessible, he uses a special type of wrench made specifically for these types of screws, and he's able to unscrew and remove the hybrid. None of this actually hurts. It just feels strange because you can feel the pressure being relieved. So while the dentist is checking the tissue for signs of inflammation, checking the implants out, they are able to take the hybrids and put them in a sonic cleaner inside a special type of solution that's going to be able to penetrate those pores and get them a lot cleaner and break up a lot more staining than you would be able to do just simply by brushing. Also, with the hybrids off, April, the hygienist, is able to really get in there and clean around the implants. Any kind of buildup that may have formed, she's able to break that up. And you'll see tools that look maybe a little bit intimidating. This one probably looks like a needle. I would have thought that it was a needle, but it's not. It is just a syringe that they use to irrigate and flush out all of those little pockets around your implants.
And guys, I am a coffee drinker. I'm a wine drinker. I do my best to keep the stains at bay, but apparently, you know, there's parts of the hybrid that I just can't see, and I had no idea that there was this much staining on the back of my hybrid. But lucky for me, April is able to buff that out with a special tool.
When the hybrid's out of your mouth and nothing is there to keep all of those tissues in place, they move around. And so for me, the only part of this whole process that could potentially cause some discomfort is when they're putting the hybrids back in. And this is what April and I were talking about with sensitivity issues. You know, if you know that, you know, in the past your tissues moved around and when they put the hybrid back on, it can pinch a little bit, then what they can do to alleviate that is just apply a topical gel that kind of numbs those tissues so that they can put the hybrid back in without causing too much discomfort with pinching. And as you can see, the last part of this whole process is to put the hybrids back in, screw them in, and plug those holes back up.
All right. Bite down, please. Make sure your bite feels good. Does it feel normal to you again? Okay, I'm going to sit you up, okay?
So, looking at everything, seeing
Yes.
that the tissues were a little bit red, how
Yes.
often do you think that they should be removed?
I would do it initially I would do it more frequently. So once you see that the tissue is not red, that's the time span. So
Okay.
some patients I have them on 3-month recalls, 4. Some are on 4-month recalls, some are on 6. So I just assess it according to how the tissue's looking. Because
Okay.
it is quite individual. To say 6 months or a year, that's generic, but I would cater it to you.
We're done here, right?
Hey,
we're
give
done.
me 5.
Okay. So that wraps it up. I hope that this was informative to you guys. Everybody's dental office is different. They have different ways of doing things. Typically, you're not going to have the hybrid removed every single time that you visit, but again, there is no one-size-fits-all approach. It is all dependent on your own unique set of circumstances and what you present, and your mouth, and it's all about your health, honestly. So I'm really thankful that ASAP Dental has decided to work with me and help provide this content to educate you guys. If you guys have any questions for them or for me, or any questions about what you've seen today, drop a comment below. If you found the video helpful, make sure that you give it a like and share it with somebody who might benefit from seeing it. Don't forget to subscribe to my channel. I post videos every Monday and Thursdays, and all of my social links are in the description box below. Information for ASAP Dental Care can be found in the description box below, and I will see you guys again next time, and y'all take care.